Welcome back, guys. This week's lab we are going to be dissecting the stifle joint. So this is the stifle joint or the genual joint. And then we're also going to look just a little bit at the tarsal joint. That's just this joint right here. So first things I want to point out is the artery and the vein that are on the leg here. So I just skinned the rabbit so I can easily see these laying right on top of the muscles. So if I take my probe here, I can get right underneath the artery and the vein. And so I have the femoral artery, the femoral vein, and actually the femoral nerve. All three are going to be right here, kind of bundled up together. So now that we've done that, we are going to actually cut off the leg. So pick one leg only. You only get one shot at this, because the other leg we're going to have to use for muscles later on. So I'm going to go ahead and cut off the animal's left leg. And really what we want to do, so here's my stifle joint, and I want to favor the proximal end of this rabbit. So I want to cut up, this is just fat right here. I'm going to kind of pick this up, just kind of peel that off. So I want to favor this proximal end. I want to cut up pretty high on the femur so that I have plenty of that bone left. So you want to take your scalpel, you're going to try to cut a good line all the way around the animal's leg. You want to cut through this muscle. Try to make one really good clean cut to the bone, because you should be able to identify all the muscles after we cut through. So we want to make it a pretty clean cut so that we can identify these muscles later. You want to go all the way around. We're basically creating a rabbit ham steak. So we're going to cut the cross section here. Okay, now that I'm pretty sure I got it all the way through to the bone, we're going to give you guys some bone shears. That's what these are. They kind of look like heavy duty scissors. And I'm going to come in here, I'm going to come into the femur, and I'm going to make one good squeeze. Nope, not on the bone yet. It's going to make a gross noise, so if you guys need to, cover your ears. Okay. Okay, so this is what I'm left with. We have a good cross section of all the muscles, and then you also are still going to be able to see the artery, the vein, and the nerve as well. So, and I can still see all my muscles in my quadricep and also in my hamstring. So that's pretty cool to see. So really the next step in this is we want to clean up basically all of the muscle that's on this leg. So we want to clean it up all the way to the bone. So you can use that, you can do that using your scalpel for these kind of bigger muscles down here in the bottom, or if you can kind of peel off this fascia that's on top, they typically will just peel right off. You know when you have a meat really tender and they just say, oh, it just melts right off the bone. Well, this just peels right off the bone. It's very appetizing. So that's all what you guys are going to do, is just clean up all of this. And be careful when you're doing this. It actually is really easy to break the tibia and the fibula apart when you're cleaning up all this muscle. So just be aware that those two bones are not attached like they are in a cow or a horse. So it's pretty easy to tear those off apart. So the other thing to note is the Achilles tendon. It attaches down here in the tarsal joint, and we're actually going to talk about that tendon a little bit later on when we're talking about muscles. So just note that that's here at the bottom, and we're actually going to cut that as well when we're cleaning off all of this muscle. The other thing to look at is when you're cleaning off kind of these big muscles is all of the arteries and veins that run through here, as well as nerves. So it is possible for, if you say you break your tibia or fibula, if that bone would happen to hit one of these arteries that are within this muscle, within the calf muscle here, it is possible for you to bleed out. And I've heard stories of like football players that break their leg and then they either lose their leg or it's like a life-threatening situation, and that's actually because they're damaging these internal parts within this leg. So I talked about earlier how the tibia and fibula are not actually fused. So what we have is we have quite a few ligaments that are going to hold our joints together so that we're able to walk and run. And the big ones that we're going to talk about are the cranial and caudal tibiofibular ligaments. So cranial meaning the top side where these two bones attach, and then also on the bottom side, the caudal side. And in people, it is very common to sprain one of those muscles. So that's what we call our high ankle sprain. And typically that's going to happen down here at the bottom. And I don't know if you guys have ever had one, but I have, and they're very, very painful. Because what those two ligaments are also stopping you from doing is these two bones separating, basically. So they're a weight-bearing ligament. So every time you are stepping with that foot, those bones are trying to separate, and those ligaments are holding it together. Okay, now that I've got my leg cleaned up just a little bit more, I've taken off a lot of the muscle. We are going to talk a little bit more up in here of the actual stifle joint. So I'm sure some of you have either heard of or actually torn your ACL or your MCL or your PCL in your knee. Once again, very painful, sometimes takes surgery to fix, yada, yada, yada. So we have the same thing in the rabbit, except for calling it a ACL or an anterior cruciate ligament. We have the cranial and caudal cruciate ligaments. And then we also have medial and lateral collaterals. And so what these ligaments do, the medial and lateral collaterals, so medial side of the animals on this side of the knee, lateral on the outside, that's stopping that knee from twisting, or those two bones from twisting apart. The cranial and cruciate ligaments, those are stopping our femur from going too far forward or coming backwards. Okay, so how we are going to test to see if these ligaments are still intact for the ACL or the cranial and cruciate ligaments, we're going to do what we call the anterior drawer test. So really what we want to do is we want to take our femur and we want to take the tibia and fibula in our other hands, and we want to try to push the femur forward and pull it back. If you have ever torn your ACL or your PCL, they typically will do this movement to you as well to see if you've torn it. So go ahead and try that on your rabbit. This one is still, everything's still intact, so you're not going to see a lot of movement or twisting going on in there. So the next thing I want to do is I'm going to take my scalpel and we're going to actually cut into the joint capsule of this rabbit's leg. Okay, so you're going to see a lot of yellow. That's the meniscus in there. That's kind of the padding. Okay, and then we have right here, That's the patella right here, tiny little bone, cutest of all bones, of course. So I want to keep tearing this back, and you might have to use your scalpel a little bit more. But what I'm trying to do here is I'm trying to expose that cranial cruciate ligament. And what I want you to do is, after you've got into the joint capsule, I want you to take your scalpel and I want you to cut that ligament. So sometimes it's easier if you can kind of hold the femur and tibia and fibula in one hand, and then take your scalpel and actually go down in there and cut that ligament. Okay, there we go, that's cut. And so then when I take my knee and I perform the anterior drawer test, already I have a lot more movement within the knee. The next thing I wanted you guys to do is I actually want you to go ahead and cut the PCL as well. PCL in people, caudal, cruciate ligament, and the rabbit. So if you can't find it to cut it, or if you don't want to cut it, you could also just actually hyperextend your knee. So if I just want to bend it this way, there, I heard it crack. So hyperextend your knee, and that's what's going to tear that ligament. So then I'm going to do my drawer test again, and you can see there's a lot more movement. And then what you can also do is come into the side, and I can see them right here. I'm going to take and I'm going to cut the MCLs and the lateral as well. Basically, your knee is going to be separated, except for some fascia that's in there. So then I have twisting motion, and I have forward and backward motion. One last thing that I want to talk about before we call it quits for today is, if you were given this rabbit leg on a test, we want you guys to be able to determine if this is the right leg or if this is the left leg. So the fibula is always going to be on the outside of the rabbit's leg, on the lateral side. So if I clean up this muscle just a little bit more here. So this is the fibula right here on the outside. So once again, the fibula is always on the lateral side, or the outside of the foot. Tibia on the medial side. So if you guys have any questions, bring them to lab. You guys are going to be doing this week. And good luck on your pre-lab quiz, and I will see you guys this week.